Yeah, hello. My name is Gabriela Mineva. I am a third-year medical student at the University of Limerick. I will be presenting my current research, which is a systematic review, and the topic is impact of breastfeeding on the incidence and severity of RSV bronchiolitis. And this is a preliminary result since I am still working on the project, and I'm under the supervision of Professor Roy Phillip from the maternity hospital as well. So he is involved in that. So just to talk about respiratory syncytial virus, or RSV, there is a massive global burden, as you can see on the map below. There are about 30 million episodes of the infection. It causes a acute lower respiratory tract infection, and majority of those cases are in the developing countries. And it is noted also that about 10% of those are hospitalized, and is really crucial in those low and middle income countries because they don't have access to healthcare facilities most of the time. And it is also why it is associated with quite a high mortality rate as well in those. And it is noted that it's a significant impact in the first year of life of an infant. And as we know that they're building their immune system at that time, so it is really crucial. So the aims of the review initially are to summarize any evidence on the impacts of breastfeeding and impacts of the incidence, severity, and mortality of RSV bronchiolitis. And I'm really focusing then on the 0 to 12 months, which is the vulnerable population or at risk as well. And we really wanted to draw conclusions if we could use breastfeeding as a cost-effective intervention just to decrease that global burden of RSV bronchiolitis. As mentioned, it is quite high. And we are looking into the evidence from the past 21 years, so from 2000 to 2021. There are some questions that we wanted to ask initially, and those were if a breastfeeding or the use of donor breast milk prevented or reduced the severity of RSV bronchiolitis. We also wanted to know if it had any impact of the rates of hospitalization, maybe just the incidence or the length of the stay. We also wanted to see if there was any impact maybe on the use of monitoring equipment or oxygen use in the hospital. And initially, back in December, I ran a preliminary search. We were looking at published works in Medline or PubMed, Embase, as well as Google Scholar. And again, those were published works. However, we wanted to expand and make sure we're covering all of our bases and look for any pre-published works in medRxiv and the Cochrane reviews as well. And I ran a secondary search then in February as well, and we probably will be running a third and final research search as well through the databases before publishing. Just wanted to give you a little snapshot of the search strategy that I initially used. Those are just some of the keywords listed on the side there. And I really wanted to make sure that I mentioned that it is also donor breast milk as well as breastfeeding itself. Some of the inclusion and exclusion criteria, we wanted to make sure it's really narrow so we can get a good result. We included a lot of different varied types like case controls, randomized controlled trials, cohorts. We did exclude, however, case reports, any case studies, any animal models or in vitro studies, any kind of letters to the editor and things like that. And we did include systematic reviews as well as meta-analysis for the review. We focused mainly on papers published in English in the time frame noted as well, and they were all human studies. We wanted to really tighten up the population criteria as well. So we took in term and preterm infants, so 0 to 1 year. We were very structured on that. And they were either breastfed exclusively or partially or with the donor breast milk. And we were observing the outcomes for bronchiolitis or RSV confirmed infection. And we excluded anybody with the wheezing symptoms or any pre-existing conditions like cardiac abnormalities. So the main outcomes we were looking at here were bronchiolitis or RSV bronchiolitis. And so that was either parent reported or professionally diagnosed in clinic, and the RSV was confirmed by a swab. And the outcomes that we were kind of hoping to see were either the hospitalization incidence or the length of stay, use of equipment, incidence, severity. So we were not really sure what we would find, but those are kind of the preliminary stats. So what I did was just search the databases via Covidence and summarize the articles there. And from then on, the data was extracted manually and charts were compiled onto a Microsoft Excel. And then I will be using EndNote as well to generate those references later. So initially, we had over 3,000 articles that popped up. And out of those, we screened about 1,400. And 215 were eligible for a full text review, and out of those, we narrowed it down to 32 that were eligible to be a part of our review, and 179 were excluded due to various reasons. So this kind of came up a little bit weird, but that's okay. So initially, we have two graphs at the moment, two charts at the moment. So one is focusing on RSV bronchiolitis, specifically with the confirmed swab. And we want to see some of the common themes there. And so a few bits that emerged were that being breastfed reduced the risk of hospitalization. And that was one of the main themes that occurred even in both segments. And then hospitalized infants were significantly more likely to be breastfed for less than 2 months or not at all, which was also quite common. And then formula-fed infants faced higher risk of infectious morbidity in the first year of life. So that's very crucial from that 0 to 1 year. And then just a table on bronchiolitis separately was about 15 studies that commented on the outcomes. And exclusively breastfed for more than 4 months significantly decreased the incidence and hospitalization risk for bronchiolitis. And breastfed infants had a lower score of severity on admission with the decreased length of stay and oxygen use, also noted by a majority of the studies. And breastfeeding from 4 to 6 months then reduced healthcare utilization. So that was in the forms of GP visits and presentation to the emergency department. So I've just included here a snippet of the sample charts that I've compiled. So there's two charts. There's one for bronchiolitis and there's one for RSV bronchiolitis, and a few studies are mentioned in both. But I'm not going to go through those, but I just wanted to show you the grid line that I've been working with. So just to kind of move on to a little bit of a discussion, RSV is still quite a new topic. Bronchiolitis as well, as we noted, is a huge global burden. So there have been some studies focusing on the creation of RSV vaccines for the past few decades. There have been some unsuccessful candidates, but there are some promising ones as well. However, I have noted that a few only are focusing on that 0 to 12 months. There are a few that are focusing on pregnant women as well as older children. So most recently, in the past decade, there's been a new monoclonal antibody called palivizumab, which is shown to prevent RSV infection, and it decreases complications from RSV as well. One downside of that it is costly, and as we noted, the major global burden is in low to in middle income countries, and if they're not able to afford it, then we would not be able to make an impact. And just conclusions from our systematic review. The WHO to this day still recommends breastfeeding practices more than 6 months exclusively as a cost-effective treatment, prevention for illnesses for children. However, our systematic review findings show that even with a 2 to 4 month exclusive breastfeeding or even partial breastfeeding, it shows a reduce in the severity of the disease, hospitalization, the length of the stay, and the supplemental oxygen requirement, which overall will decrease costs associated to governments as well. There are a couple of limitations. We do have a very stringent kind of narrow criteria, which does give us a small sample size, but I'm hoping with another search of the databases, we could yield a few more articles. And there are a lot of studies that are mentioning the mechanisms of how breastfeeding can protect infants However, we're not focusing on that. We're just looking at more of a global picture. And this is kind of the start of further research down the line that Professor Roy Phillip is working as well. So this is kind of the preliminary work. And that is it. And those are some references there in the back as well.